lovelies, it's Cindy from MyStyleSpot. Now, surgery abroad is becoming more and more popular, and a couple of reasons for this is it is less expensive, and sometimes you can get procedures abroad that you may not be able to get here in the US. It can seem scary. Some of us may not know exactly what we need, but want to meet with a doctor first. And that's why I love this company called Jivaka.care. They are an online video consultation service that allows you to speak with a Korean doctor beforehand and get your consultation in so you know what to expect. You can ask any questions you have and basically just put your mind at peace before you head there for surgery. Unlike with many other abroad procedures around the world, you don't get this service. So this is pretty amazing. Communication can be hard. You may not speak the language. It can be very scary. But with Jivaka.care, it is English speaking. So you'll be able to talk to your doctor in English or through a translator and get all of your questions and answers met. They only have board certified specialists, in which I recommend definitely be sure to research your doctor before you ever do any kind of procedure. That is uber important. You want to know what you're getting yourself into. So I love that about Jivaka.care. You know that you're going to get the best and you don't have to worry that way, but I definitely would research it as well. You can get both cosmetic or medical procedures through Jivaka.care. And one of the major benefits of this service is you can live anywhere in the world and get this consultation. You don't even have to be here in the US, which is pretty awesome. Yeah, a personal, accurate diagnosis from a real doctor speaking with them online. It can be very beneficial in helping you make a decision. And unlike many abroad procedures, you can't always get a consultation beforehand. So that's what really makes Jivaka.care unique and special. So I have been wanting to do an eye procedure for quite some time. I tend to have these droopy, saggy, old lady lids. So I've wanted to get an eye lift, and I was very curious to meet with a doctor, a Korean doctor through Jivaka.care, and see for myself what it was going to be like, get a consultation and be able to ask some good questions and get his thoughts on whether or not I need this procedure and how he can help. So check out my consultation I had here online with Dr. Ri through Jivaka.care.
So what is your main concern?
I have saggy, kind of droopy eyelids, so I want to do like an eye lift.
So usually we know as the upper blepharoplasty or eyelid lift. So in that case, the main problem is the skin, the ptosis, kind of the excessive skin, the cover the folds and hang over the folds. So as we age, also with skin extend and become more lax. So because why there's the skin ptosis. Also there's fat bulging or the muscle ptosis is also, it can be happen, but the main reason is the skin problem. Okay, you have the definite, the double fold, and that the excessive skin hang over that fold. So when we do the surgery, we using your original fold and we cut the excessive skin over your fold. So yeah, that's the basic of the surgery.
Okay.
So skin become more lax is we feel very heavy and become more severe. It cover and limit the peripheral vision. And at night or at the dinner, when you're tired, it feel very heavy. So that's why we do the surgery. Also the cosmetic reason or the functional reason. So usually the procedure and surgery takes within 1 hour under the local anesthesia. We design the amount of the excision of the skin. Then we do the local anesthesia and cut the skin, and also we apply the muscle modification or fat, also the fat. So then we close the operation field.
Okay. Sounds good. How long is recovery time?
Usually the swelling and bruise will be 2 weeks. 2 weeks. And stitching will stay in 1 week. Okay. And at that time, 2/3 of the swelling will gone. So after 1 week, you can do almost the daily activity.
Oh, okay. That's good to know. Is this a procedure that would ever need to be done again in the future? Or is it kind of one and done?
Usually in the Asia, we do the eyelid surgery around 20.
Okay.
So at that time, we do not cut the skin much.
Okay.
Because there's no skin sagging or there's no ptosis. But after 20 years later, maybe around 40, we do this kind of the upper eyelid lift or upper blepharoplasty. So in that case, some patients do one more time, maybe around 60 or 70, but it's very few.
Okay, that's good to know.
Yeah, almost all patients just do once. Yeah.
Great.
Using this surgery, we can not only improve the skin problem, we can correct the fold symmetry or eye opening power, and also the brow asymmetry like that. So we can correct the cosmetic part of the eye.
Okay, that's great. Is this a very common procedure?
Yeah, I think it's the most common surgery in Korea. Also, I think, yeah, also it can be applied to the States, but I'm not sure. But also in Korea, it's most common surgery.
Okay, so it's a good place to do it then. What would be the cost for it?
Cost. I'm doctor, so I cannot judge the price, and I heard many times. I think maybe 이거 뭐라 해야 되니? 1,500 to the 2,000.
Okay, perfect. Is it a painful recovery?
I think the most painful part is during the local anesthesia.
Okay.
So we have to inject the local anesthesia. That is the painful part. So at that time, we do the kind of sedation. It's just sleep 5 to 10 minutes. So you cannot remember and you cannot feel the pain.
Okay, awesome.
After that, you will awake, and we do this surgery, and we tell you open your eye, or that's why the judge and we see the asymmetry or fold height like that. So during the surgery, the patient and doctor talk about the status or kind of the eye opening like that.
Okay. And then how many times would I need to come back for a post checkup?
Usually at that time of the surgery and the day after the surgery.
Okay.
And 7 days after the surgery for their stitch out.
Okay. So I need to be there like at least a week. 2 weeks to recover.
Some foreign patients go back 2 days later or 1 day later after the surgery, but patient has a time they stay a week I think is better. Yeah.
Okay, perfect. I think that's pretty well my questions about it. You've been very helpful. Thank you.
Yeah, thank you so much too.
All right, so pretty awesome, right? I felt like I got all my questions answered. I feel much better, much more knowledgeable about the procedure. It was nice to get his specific take on it, and for me personally, how it would benefit me. So I really loved hearing that. Really love the Jivaka.care service. It is really amazing and really effective for helping me feel more knowledgeable and like I'm taking things into my hands instead of just throwing it out there, not knowing what to expect when you have surgery abroad. So if you'd like to check them out, you can check them out at Jivaka.care.com. Thank you so much for watching. If you like this video, please like, comment, share, and subscribe. Thank you.